I'm going to talk about bones today, skeletal health. I mentioned it fleetingly in my earlier talks, but it's really important to think about bones. One of the interesting facts is our bones actually don't get any thicker after our mid-20s. And that's why it's important to make sure that children have lots of vitamin D in their diets, lots of calcium. Thereafter, while we produce estrogen, there's an in-out situation of the bones. The bone is a living material, even though it looks solid and it doesn't seem as though it's moving. There's lots and lots of busy cells inside, and the cells that are breaking bone down and the cells that are building bone up. And that in-out situation is stable. And it is made stable predominantly by estrogen. So once you stop producing estrogen, what happens is the cells that are breaking the bone down are not stopped as much as the cells that build it up. So bones become thinner. And when it becomes thinner but you have no symptoms, it's called osteopenia. When it becomes very thin, it's osteoporosis. Osteoporosis itself doesn't have any symptoms. It's the consequences of osteoporosis. Osteoporosis runs in families. It's made worse by smoking. It's made worse by drinking. It's made worse by no weight-bearing exercise. It's made worse by not having any dairy in your diet and very little vitamin D. Some of that we can control. In fact, most of it we can control, but we can't alter our genetic picture. Myself, for example, my mum was 5'3" and she married my dad, and she died last year, but she was 4'8" when she died. And in the slides when I do my presentations, I've got a picture of them at their wedding day and a picture of, bless them, their 64th wedding anniversary, which was 2 weeks before she died. And you can see the massive difference. And she'd been through so much pain with her vertebral collapse from osteoporosis. 110 out of every 1,000 women will have a hip fracture. And that's not the vertebral collapse that I talked about with my mum. That's a hip fracture. And the mortality is about 30% associated with a hip fracture. So we need to look about how we stop this happening. That's why doctors talk about HRT. It does protect our bones, and certainly when I see young women with premature ovarian failure, I do give them quite a strong case to take estrogen, because if they're 35, they could be living for another 60 years in the absence of estrogen. So, we need to eat dairy produce. We need to sit out in the sun when the sun is higher in the sky for shorter periods to make our vitamin D, because we can't make vitamin D if our shadow is very long. We need to cut down alcohol. The calories in alcohol are much lower in white wine than red wine, and we need to stop drinking bubbly drinks, because what bubbles do is they catch calcium. We also need to have good mental health for us to be able to do all the things that protect our bones. So how do we put all that together, I say? And people look at me as, how on earth are they going to remember? There's two ways to remember. One is to look at the Royal Osteoporosis website. How am I going to remember that? Okay? Menopausal women are hot, like a thermos. So write the word thermos down. Then we've treated your menopause, so cross the M out and you're left with THEROS, the ROS. That is the website for the Royal Osteoporosis Society. And that will give you lots and lots and lots of information. And the other thing to finish with is a bit of a story, which everyone seems to remember. I want you to get on the Eurostar to Paris. I want you to walk for your weight-bearing exercise, because that's really important. I think I missed that out earlier about the exercise. It must be weight-bearing. Swimming is great for the heart. Cycling is great for the heart. Yoga is good, but it needs to be weight bearing for your bones. So don't get a Boris bike in Paris. Walk to your tourist attraction of your choice for your mental health. Then choose a pavement cafe and sit outside in the sunshine when the sun is high in the sky, drinking chilled Sauvignon Blanc, eating brie.